Okay? So from the age of 25 on, 1 in 4 people will at some point in time statistically experience a stroke event. And that's a pretty high incidence if you think about it. Okay? In terms of risk factors, they talk about unmodifiable. So the things that you cannot change, your age, right? As you age, we talked about earlier, there's a greater incidence or potential for you to experience major health incidents. Your gender. Women are more likely to stroke than men, partially because of our hormonal makeup. Pregnancy in younger women is a big part of what they experience as opportunities for stroke. Race is another area you can't control. So folks with African American or Latina background are almost twice as likely to have a stroke than are their Caucasian counterparts. And if you've had a history of stroke in your family, you have also a higher incidence or risk of that being a risk for you. However, we talked about 80% of what happens are preventable. And so those are things like high blood pressure. You know, do you or your loved one have that as something that's in your medical history? And what are you doing to keep it under control? Heart disease, diabetes, you know, keeping your diabetes managed. Cigarette smoke, heavy alcohol consumption, high cholesterol, right? So what we're taking into our bodies and how we're managing that are all parts of the modifiable things that we can change. Okay?